Implementation of the School Disaster Risk Reduction Management in Public Elementary Schools in Region 8. The topmost hazard exposure of the learning environment were tropical typhoons, quake, floods, and volcanic activity. The schools and learners were among those who suffered a lot. DepEd Order Number 50 Series of 2011 and DepEd Order Number 11 Series of 2015 institutionalized disaster risk reduction management in basic education. It is composed of chairman, co-chairman, early warning team, disaster management and relief services, camp management and relief services, damage assessment and head analysis, and recovery and rehabilitation. The team is tasked to conduct advocacy campaign along with the importance of disaster risk reduction management in school and maintain connections with local and national. However, little attention on disaster risk reduction management programs and activities had been given to the learners. Learners who are more vulnerable to damages, suffering, injuries, loss of academic performances, and even death. The research gap in terms of increased knowledge and understanding disaster risk reduction management remain an enormous challenge to the team. This study aimed to assess the level of implementation of the school disaster risk reduction management in public elementary schools in Region 8. It addressed the following: 1. What is the characteristic profiles of the dream team in terms of age, sex, civil status, educational attainment, position in the team, numbers of trainings attended, membership in any disaster risk reduction management related organization? 2. What is the implementation level of the school disaster risk reduction management as assessed by the team in terms of the following: program resources, disaster preparedness, disaster response, disaster relief and rehabilitation, program activities, being a disaster manager, component of disaster management, introduction to disaster management, specific mitigation and risk preventing ordinary man-made calamity. 3. Is there a difference in the assessment of the team on the level of implementation of the school disaster risk reduction management by profile variables? 4. Is the profile of the team and the level of implementation of the school disaster risk reduction management related to? 5. Based on the outcomes of the study, what development plan may be proposed? A correlational descriptive design of research is applied in this study. The respondents were 469 respondents from 67 central schools. The 67 selected central schools have 7 members of SDRRM team. The SDRRM team profile were analyzed using frequency tally and percentage to compute the response on the extent of implementation of school disaster risk reduction management assessed by team. Mean was used to test if there is a difference on the ratings given by the SDRRM team on the level of implementation of school disaster risk reduction management. The t-test was used for 2 independent samples, and if there is a relationship between the profile of the team on the ratings on the level of implementation of the school disaster risk reduction management, the use of point biserial correlation, person product moment correlation coefficient, and eta correlation were deemed important. Result and discussion. Table 1, Profile of the SDRRM team. Presented in Table 1 is the profile summary of SDRRM team. The SDRRM respondents are mostly 36 to 50 years old, 55.65%. Majority are females, 72.2%. Married, 74.84%. Mostly have obtained master's degree, 44.6%. Have a fairly trainings on DRRM, 53.30%. Most are members of Barangay DRRM, 13.86%. Equally distributed across the SDRRM position, 14.29%. Table 2, Level of Implementation of School Disaster Risk Reduction Management in terms of disaster preparedness. As shown in Table 2, the respondent assessed that the SDRRM implementation in the region in terms of disaster preparedness as highly implemented, with an overall mean of 3.56. This implies that the SDRRM team in Region 8 are directly involved in disaster preparedness program. Table 3, Level of Implementation of School Disaster Risk Reduction Management in terms of disaster response. As shown in Table 3, the respondent assessed that the SDRRM implementation in the region in terms of disaster response as highly implemented, with an overall mean score of 3.57. This implies that the SDRRM team in Region 8 are directly involved in disaster response program. Table 4, Level of Implementation of School Disaster Risk Reduction Management in terms of disaster relief and rehabilitation. As revealed in Table 4, the overall mean for SDRRM in terms of disaster relief and rehabilitation is 3.40, indicating that this area of SDRRM is moderately implemented. This implies that disaster relief and rehabilitation program is not yet fully programmed and implemented by the SDRRM team in Region 8. Table 5, Level of Implementation of School Disaster Risk Reduction Management in terms of being a disaster manager. As can be gleaned in Table 5, the overall mean is 3.50, indicating that this area of SDRRM is highly implemented. Table 6, Level of Implementation of School Disaster Risk Reduction Management in terms of components of disaster management. As shown in Table 6 as evidence, overall the activities under components of disaster management obtain a mean of 3.44, signifying that these activities were highly implemented. This implies that the SDRRM team in Region 8 were directly involved in components of disaster management activities. Table 7, Level of Implementation of School Disaster Risk Reduction Management in terms of Introduction to Disaster Management. It is reflected in Table 7 as a whole are gauged as highly implemented, as evidenced by a mean of 3.64. This implies that the SDRRM team in Region 8 are directly involved in introduction to disaster risk management activities. Table 8, Level of Implementation of School Disaster Risk Reduction Management in terms of specific hazards and mitigation. As shown in Table 8, the overall mean of the indicators under is 3.69, which indicate at large the activities outlined by these indicators were highly implemented. This implies that the SDRRM team in Region 8 are directly involved in specific hazards and mitigation activities. Table 9. Level of implementation of school disaster risk reduction management in terms of preventing common man-made disaster. It is depicted in Table 9 that the overall mean for preventing common man-made disaster is 3.73. This implies that the SDRRM team in Region 8 are directly involved in common man-made activities. Table 10. ANOVA test for the difference in the level of implementation of SDRRM by age group. This signifies that the same level of implementation of each SDRRM area as perceived by the respondent group by age. Table 11. Test for the difference in the level of implementation of SDRRM by sex. This signifies that the same level of implementation of each SDRRM area as perceived by the respondent group by sex. Table 12. ANOVA test for the difference in the level of implementation of SDRRM by civil status. This signifies that the same level of implementation of each SDRRM area as perceived by the respondent group by civil status. Table 13, ANOVA test for the difference in the level of implementation of SDRRM by educational attainment. This implies that respondents who pursued higher educational attainment tend to post higher level of implementation, while those who did not pursue educational attainment tend to post lower level of implementation. But in terms of disaster relief and rehabilitation, being a disaster manager are considered not significant on the level of implementation for as long as the team has the spirit of volunteerism, hard work, rescue provider, commitment, and dedication to work. Table 14. ANOVA test for the difference in the level of implementation of SDRRM by position in the SDRRM team. This signifies that the same level of implementation of each SDRRM area across position in the SDRRM team. ANOVA test for the difference in the level of implementation of SDRRM by number of DRRM trainings attended. This implies that the respondent who have more DRRM related training tends to post higher level of implementation, while those with lesser DRRM related trainings tend to post lower level of implementation. Table 16. ANOVA test for the difference in the level of implementation of SDRRM by membership in any DRRM related organization. This indicates that there is the same level of implementation of each SDRRM area across categories of membership in any organization. Table 17. Relationship between the level of implementation of SDRRM and the profile variables. The findings indicate that the higher the educational attainment of the SDRRM team members, the higher the level of implementation of the SDRRM related programs and activities. This further signifies that it is a good practice for school to finance the professional development of the teachers assigned to SDRRM focal person through postgraduate degrees and courses, especially those covering SDRRM. The findings show that frequent attendance to SDRRM trainings is associated with high level of implementation of SDRRM related programs and activities. However, it is important to note that prior to selection of trainees, a needs assessment must be conducted to avoid a mismatch between the SDRRM competencies of the trainees that need to be enhanced and the type of SDRRM training to be attended. In other words, the selection of the training participant should be based on assessment results and not by random identification. In conclusion, the team are mostly 36 to 50 years old, females, married, obtained master's degree, early trained on DRRM seminars. Majority were members of barangay DRRM team and equally distributed across the SDRRM position. Among the eight major areas of DRRM implementation, only disaster relief and rehabilitation were moderately implemented, while the remaining seven areas were highly implemented. Of the 55 specific programs and activities under DRRM implementation, 42 were highly implemented and 13 were moderately implemented. No significant difference as revealed in the implementation of activities under disaster relief and rehabilitation and being a disaster manager. When the SDRRM team are categorized corresponding to educational attainment. Meanwhile, in the level of implementation, there is a significant difference of each SDRRM area across on numbers of DRRM related trainings attended by the respondent. The educational attainment and number of DRRM trainings attended by the respondent on the level of implementation of school disaster risk reduction management showed a significant relationship. The following recommendations would enhance the implementation of SDRRM in public elementary school in Region 8. 1. The SDRRM team must undergo capability enhancement trainings to equip them with more DRRM knowledge and skills. 2. Improve the level of implementation of SDRRM in the remaining 13 specific activities from moderately implemented to highly implemented. Hence, this could possibly be done by assessing the SDRRM team and conducting trainings for them, and could be possibly realized by strengthening the networking on linkages with other agencies, both government organization and non-government organization, for they are considered a strong support that the school have. And since educational attainment have a positive relationship with the level of implementation of SDRRM, the administrators and teachers should be encouraged to pursue further studies that would equip their knowledge and skills in the future. 4. The SDRRM school should ensure coordination with the local government unit and health units on matters relating to COVID-19. And 5. SDRRM development plan to improve the implementation of SDRRM in public elementary schools in Region 8.